So, when talking about pulmonary pathologies, one of the things that's very important to have is a set of vocabulary terms to describe a patient's breathing. Some of these are going to be normal, non-pathological rhythms, and some of these are going to be rhythms that are associated with pathology. The first one, of course, is not associated with pathology. That's eupnea. You'll note that most of these end in pnea, and pnea basically means breathing, and eu means true. So this is true breathing, quiet, relaxed breathing. This is normal, non-forced breathing, using, the diaphragm and your scalenes and intercostals for inhalation, and using no exhalation muscles. Apnea, the prefix a means without, so this means not breathing. Hopefully it's a temporary not breathing, because if it's a permanent not breathing, it typically means you're dead. But a temporary cessation of breathing, this is most commonly associated with sleep apnea or obstructive sleep apnea, which is when someone stops breathing temporarily, specifically in their sleep, usually when the muscles of their soft palate relax and obstruct the airway, and they stop breathing until their brain wakes up enough that those muscles tense again, and that clears the airway and they can take a breath. And then the cycle repeats. Dyspnea. Dys, like destruction, means, bad. And in this case, this is bad breathing. Labored breathing, gasping for breath, shortness of breath, that kind of thing. Hyperpnea means fast, deep breathing. This could be pathological or non-pathological. It's a normal breathing pattern to go into during exercise. It's also a fairly normal reaction to pain, but it can also be caused by other conditions, panic disorder, as well as a number of other pulmonary diseases. Hyperpnea and hyperventilation are sort of related. The difference is that hyperpnea specifically is fast, deep breathing. Hyperventilation would be fast, deep breathing in excess of what your body needs. So if you're breathing fast because you're exercising, you're not hyperventilating. You're just ventilating normally. However, if you're breathing really fast because you're scared or because you're panicking or something like that, that would be hyperventilation, because you don't need to be breathing that fast physiologically. Hypoventilation is the other direction, when you're not breathing as much as you physiologically need to. This leads to an increase in blood CO2, usually blood acidification. Cusimal respiration. This is deep, rapid breathing, sometimes induced by acidosis, and is sometimes diagnostic of acidosis. And it's basically a form of hyperpnea that is in response to blood acidosis, so it's not hyperventilation. It is physiologically necessary. But it's also not necessarily associated with exercise. Orthopnea. This is a specific type of dyspnea that occurs when a person is lying down. So this is labored breathing associated with a supine or prone position. Respiratory arrest. Well, this is what happens when an apnea goes on too long. This is a permanent cessation of breathing, or something that would be a permanent cessation of breathing if not for intervention. It could be due to obstruction, like, say, choking or getting something stuck in your throat. It could be due to cardiac arrest. It could be due to a number of other things, but means the patient has stopped breathing and will shortly die unless something is done to start their breathing again. Tachypnea. You may have heard of tachycardia, which is a fast, accelerated heart rate, and tachypnea is fast, usually short respiration. Like that. It's not necessarily fast, deep breathing, it's rapid, shallow breathing. Most respiratory disorders are going to manifest as some sort of oxygen imbalance. Usually a lack of oxygen. There are very few respiratory disorders that I can think of that result in an excess of oxygen, since really, you know, in your lungs at least, your blood oxygen levels should be at basically 100% in any case. So, if you have trouble breathing, or you have some sort of obstructive pulmonary disorder or something like that, your lungs aren't functioning properly, this is going to result in some sort of hypoxia. Hypoxia means too little oxygen. And specifically, this is a deficiency of oxygen in a tissue, or the inability to use that oxygen. And there are several things that can cause hypoxia. There are a lot of things that can cause hypoxia. Examples: hypoxemic hypoxia. This is a state, this just basically means you have low oxygen in your arteries. Like, you have hypoxia because your blood cells are not getting enough oxygen. You've got plenty of blood cells, they've got places for oxygen to bind, but oxygen is not binding them. This usually means that you have some inability to get oxygen to the alveoli of your lungs. This could be because of obstruction. For instance, you're drowning, choking on something, in some sort of respiratory arrest. It could be due to a lack of oxygen in the air. Oxygen deficiency at high elevations. You'd have to be pretty high up, but it's possible. Or it could be due to organic damage to the lungs. For instance, if you have pneumothorax, you have a punctured lung, you have bleeding inside of your lungs that is preventing oxygen from getting in, some sort of degenerative lung disease that is reducing your lungs' ability to function. Right? The problem is that oxygen is not getting into your blood. You can have ischemic hypoxia, where the problem is that your blood is not circulating. If this happens at a systemic level, it's usually a result of cardiac arrest, or congestive heart failure, some sort of cardiac insufficiency. Your heart is not pumping enough blood. On a local level, it could be due to some sort of restriction, pressure placed on a blood vessel that's preventing blood from getting to a particular organ or area of the body, such as the case in a pressure ulcer. Anemic hypoxia. This is hypoxia due to a lack of blood cells, or a lack of the ability of blood cells to carry oxygen. It could be due to iron deficiency. You don't have enough iron in your diet, so you can't make hemoglobin. Therefore, you can't make effective red blood cells, and you're not carrying enough oxygen. Even if you get plenty of oxygen to the lungs, there just isn't enough blood to carry it. Or it could be due to a genetic defect, like sickle cell anemia, thalassemia, something like that, where there's some deficiency in your ability to make hemoglobin or to make red blood cells. Histotoxic hypoxia. This is usually going to be the result of a tissue toxin that prevents cells from using oxygen. For instance, cyanide, and another of other, and many other metabolic poisons work by preventing the electron transport chain in the mitochondria from effectively using oxygen, and then you die because your body can't generate ATP. Most, not all, but most hypoxias result in cyanosis, or a bluing of the skin. That usually means that there's not enough oxygen present in the blood. So hypoxemic hypoxia, ischemic hypoxia, anemic hypoxia, all of these will result in cyanosis. Histotoxic hypoxia won't, because that's the one where you have, like, plenty of oxygen in your tissues as being delivered. The problem is with your tissues being unable to actually use the oxygen. Cyanosis is usually a good sign or a bad sign of hypoxia. Pulmonary disorders typically fall into two classifications. They can be restrictive or obstructive. And this has to do with basically the two things that affect resistance to flow. Restrictive disorders reduce pulmonary compliance. And if you'll recall, compliance is the ability, the ability of your lungs to be stretched and to rebound from stretching, right? How elastic your lungs are. And it's a property that decreases typically with age and damage. So anything that reduces pulmonary compliance is going to be a restrictive disorder. These are usually going to be caused by things that cause a buildup of scar tissue in the lungs. Black lung disease, tuberculosis certainly fall into that category. Lung damage from asbestos. Smoking can cause pulmonary fibrosis. Black mold can. Basically anything that does, just damage to particularly, the airways. And we have obstructive disorders. So, obstructive disorders interfere with airflow by narrowing or blocking the airway. And these are going to increase resistance by decreasing the diameter of the airways and or completely blocking the airways, and that's going to make it harder to breathe and possibly make some areas of the lungs where you just can't breathe. Some examples of this: asthma, which is a sort of allergenic or autoimmune associated contraction of the bronchioles. Chronic bronchitis, which is inflammation of the bronchi and bronchioles, which can be caused by viruses, bacteria, autoimmune disorders, a number of different things, smoking. And emphysema. Emphysema is a weird one. I'll talk about that in a second. So, COPDs. chronic obstructive pulmonary diseases or disorders. These are non-temporary, so long-term obstructive diseases, kind of in the name there. These are things that long-term obstruct airflow and reduce pulmonary ventilation. Two of the most common COPDs are chronic bronchitis and emphysema. Both of these are associated with smoking, and these days are usually associated with smoking, at least in the US. They can be associated with other chemicals that damage the lungs. For instance, some, like, in cities that really haven't gotten their air pollution under control, and I mean really, like, where you can't see the tops of buildings kind of thing. Or certain chemicals, if you work in certain types of chemical plants and you don't use your breathing apparatus properly, certain mining in certain areas and getting the dust from mines in coal or other things like that into your lungs can cause these. But in the US and most of the developed world, the most common cause is smoking. Right, so other factors: air pollution, occupational exposure to airborne irritants, usually chemicals, occasionally hereditary defects, cystic fibrosis comes to mind, but they're fairly rare. We'll take a little bit more of an in-depth look here. Chronic bronchitis is a severe, persistent, lower respiratory inflammation, where you produce basically your bronchioles are going to constrict, and your bronchi are going to secrete excess amounts of mucus, as you would expect during an inflammatory response, which, like, over the short term, in response to, like, a cold or something, is often a good thing. But if it carries on for too long, what it eventually does is it gets too thick in the cilia of the ciliated epithelium, and basically causes the cilia to harden and break off. Once the cilia harden and break off, the thick stagnant mucus catches bacteria, then drains down into the alveoli, where those bacteria can now cause infection. Often leading to pneumonia and other lower respiratory tract infections that then keep the inflammation going on. This is associated basically with chronic lung damage, usually due to smoking, because smoke, any type of smoke, but particularly cigarette smoke, actually kills and compromises alveolar macrophages, which would be your last line of defense against the bacteria in your alveoli. You end up developing a chronic cough because your cilia don't work to get your mucus up. So the only way you can get your mucus up is to cough constantly and spit it out. Eventually that will often turn into a bloody cough, as the coughing does damage to the inside of your lungs. Emphysema, as opposed to being damage to the cilia of the bronchi, is damage to the alveoli. And what happens is that, so usually your alveoli are like, you have your terminal kind of bronchiole there, and you have your alveoli, you know, kind of clustered around the end here, and you have got a whole bunch of alveoli clustered around. In emphysema, what happens is that you damage the alveoli, and you damage them enough that they don't fully grow back, and you end up with fewer, larger alveoli. And that might not be obvious how that's bad, but the reason why you have all of those tiny clusters of alveoli in the first place is to maximize surface area. In this circumstance that you have here, you have less surface area, and that means that you have less gas exchange going on. Not as much oxygen gets into your blood, leading to hypoxemic hypoxia. In addition, the constant damage to the alveoli is going to cause the growth of scar tissue in the areas that were damaged, and fibrotic scar tissue is not elastic, and so this is going to reduce the compliance of your lungs as well. So emphysema, actually, even though it is a type of COPD, emphysema also has elements of a restrictive disorder. Eventually, you have to breathe so deep, so often. You have to breathe deep and put muscles into it because of the compliance issues, and you have to breathe so rapidly and frequently because you're not getting enough gas exchange. Eventually, this leads to a very distinctive barrel-chested look, where excessively using those muscles actually causes your chest, your rib cage to expand. And eventually the air passages widen out so much that they actually start to collapse. Air becomes trapped in the lungs. This is irreversible. There's no cure for it. Treatments usually involve oxygen therapy. Like you put somebody on an oxygen tube so that they can get more oxygen in with less breathing. Possibly a barometric chamber, eventually iron lung. Theoretically, I suppose a lung transplant could resolve the issue, but people who are emphysemic are often considered poor candidates for lung transplantation.